Good evening. Thank you for joining us tonight for our 18 News digital exclusive State of the Virus. Now, as cases of COVID-19 continue to rise locally and across the country, 18 News is giving you, our local viewers, an opportunity to ask local experts your questions regarding COVID-19. And today we're joined by Dr. Michael Scalzone, the Chief Quality Officer for Guthrie. And thank you for joining us once again, Doctor.
My pleasure, George.
All right, so we have a vaccine now. It's starting to get distributed, and there are a lot of questions about who will get it and who won't. So can you kind of break down the order for our viewers of who's going to get the vaccine first?
Sure, I'd be glad to. The recommendations come from both the CDC as well as our state health departments. And the guidance is really quite consistent. The two main populations that will be targeted first are healthcare workers that are exposed to COVID-19 patients and those most vulnerable, meaning in long-term care facilities or nursing homes. And the rationale for this is to try to decrease the pressure on our hospitals. That is really what we are trying to do, is have fewer people require hospitalization for COVID-19.
All right, so of course, in our area and across the country, thousands of patients have already had the virus. So we go to our first viewer question here from Dorothy in Horseheads, who asks, will those people get the vaccine, those who have already had COVID, or will they be moved down the line to get it at a later date?
The recommendation is that even if you've had COVID-19, you should still be vaccinated. And the logic is that we don't know whether natural immunity or a vaccine is more protective. And that's going to take quite a few months before we'll know that information. We do believe that there's no harm to being vaccinated, even if you've had the prior illness, but we do believe that it's safer to be vaccinated, and that is the recommendations from the CDC.
All right, and once those people do get the vaccine, in some cases they have to get the booster shot as well. Will they still have to wear a mask and practice social distancing, as all these health experts have been asking people to do?
It is important to continue to wear a mask. And while that may not be intuitive at first, it really is very important. The reason is we know the vaccine is very effective at reducing severe illness and people needing to be hospitalized. However, it's still undetermined whether or not there's a chance of someone being vaccinated and still be contagious, whether they could be an asymptomatic carrier and still carry the virus for a short period of time. Until that's known, the recommendation remains, even if vaccinated, wear a mask, avoid large gatherings, and continue to be careful, as we've suggested for months now.
All right, and there's also been a very small number of people who have had allergic reactions to the vaccine. So what should people know about that? And is this something where it's the vaccine causing it, or possibly the latex that's being used to administer it?
Well, George, you're right that it is a very small number. During the large clinical trials, that really wasn't seen to be a significant issue. However, you're right, there have been some reported allergic reactions in those individuals who have had severe allergies before. There actually is no latex in the vaccine or in the equipment that's used to vaccinate. And most of the ingredients in the vaccine are very similar to what people get with the flu vaccine or otherwise. So we really believe it is safe, and it will be rare that people have serious reactions to it.
All right, that's good to know. And now we're going to go to our final viewer question, this one from Anthony and Elmira. He asks, what are the suggested protocols for a person that they should follow after receiving the 2 doses of the COVID vaccine?
So getting the 2 doses is very important. 1 dose alone is not as effective as having 2. And then after the second dose, there still is a little time before you're completely protected. And as I mentioned earlier, there's still the need for masking and avoiding large crowds to maintain protection against transmission. So although it's very protective for the individual being vaccinated, we still have to be careful until we can get most of the community vaccinated and really work on that herd immunity, which is going to help to slow and stop this pandemic.
All right, Dr. Scalzone, thank you so much for joining us today. Stay safe this holiday season, working there in the hospital at Guthrie. And viewers, if you have a question regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. And of course, we'll have more on the fight against COVID-19 on 18 News and on mytwintiers.com. Thank you for joining us, and have a good night.